Okay, so welcome. My name is Jayna Heerema. I am a therapist here at MedPsych, and I'm excited to talk about anxiety in children and teens today with you guys. Just one thing to mention is there is a Q&A kind of tab at the bottom of your screen. So if you have a question, you can just write it in there. I'll most likely answer most of them during our Q&A session at the end. But if I feel like it's appropriate to answer at the time, I can do that too. So just you can put them in as we go, and I'll look at them most likely at the end during our Q&A time. So before we get started, I'm going to talk about just a little bit about MedPsych and what we offer. So we offer psychiatry, therapy, autism, and ADHD testing. And something that is really cool about MedPsych is the psychiatrists and the therapists work very closely together. So sometimes psychiatrists have a bad reputation of just seeing someone for like 10 minutes, writing them a script, letting them go. But as a therapist here, it's very great to have collaboration with the psychiatrist and we can kind of work together. So we have services for children, teens, and adults, so all ages. And we have offices in Old Japan, Ramsey, where I work, and also in Montclair. And then a little bit about myself. I graduated from Ramapo College of New Jersey, right in Mahwah, with my master's in social work, and then I became a licensed social worker. My background, I started in a therapeutic high school setting, so it was working a lot with like 8th through 12th graders who have any like emotional regulation impairment. So things like anxiety, depression, autism, ADHD, and I did a lot of dialectical behavior therapy. I'm not going to go into too much of what that is, but if you have a question about that, you can we can answer it at the end. And then currently at MedPsych, as a therapist, I do DBT and then also cognitive behavioral therapy, CBT, and trauma-informed care. And I work mostly with children and teens. So getting into it, what kind of anxiety is, I know that word is thrown out a lot right now. It's kind of like a buzzword, but more from a clinical standpoint, it's basically just worry that's out of proportion to whatever the perceived threat is, or it could be just or inappropriate to a child's stage of development or their age. So for example, if you have a 12-year-old who is very afraid of mom or dad leaving them home or mom leaving the house. And say when mom leaves the house, they have a full-blown tantrum. There's a lot of crying, screaming. So that would be inappropriate to the child's stage of development. So it might be appropriate for like a 2-year-old. And it's also out of proportion to what the perceived threat is. Diagnosed anxiety has to be present for a certain period of time, like 1 to 6 months, depending on the diagnosis. And it can differ depending on the type and again, on the age of your child. So something that we might see in like a 7-8-year-old is going to be different than anxiety in like a 17-year-old, 18-year-old. So it's important to just mention that. So these are the different types of anxiety. I'm not going to go into them all specifically, but just for you to kind of see what they are, I would say generalized anxiety disorder is what we see most often. Then you have those different ones that are on there. I also wrote obsessive compulsive disorder, OCD. It is not technically a type of anxiety, but it can show up very similarly. So I wanted to put that on there as well. So again, you can take a look. If you have any questions specifically about any of these, you can put it in the Q&A and I can answer at the end. But again, I'm not going to go too much into them specifically. So kind of getting into the core features of anxiety in youth. So what you might see from your child who might be anxious, worried, those types of things. So the first thing is hypervigilance. So your child, you might see them just like as kind of like a high strung child, very tense. They might seem on guard a lot of the time, like always kind of on the edge of their seat. Um, and something that you could see is being very reactive to a change in plans. So, for example, if you tell your child, okay, after school today, we're going to go home, we're going to eat, have a snack, and then you're going to go to basketball practice and then come back home. And then say you have a relative that randomly comes up, they're in the area, pick your child up from school and you say, oh, Aunt Sally's in the area, we're going to skip basketball practice and we're going to go hang out with her. And you might see them have a very big reaction. And it's not because they don't want to see their Aunt Sally, but it's just because they had a plan in mind and they wanted to stick to that. And so a child or a teen with anxiety could be very thrown off by something like that, like a small change in plans. So that's hypervigilance. Avoidant coping. So you would just see your child avoiding whatever they're afraid of at all costs. So if it's just in general going outside the house or meeting with friends, they don't want to do that. You'll see them kind of react to that. So if they know they're going somewhere, they might throw a tantrum, cry, try to negotiate with you. If what they're afraid of is like mom leaving the house, they'll say, Mom, can you stay 5 more minutes? Can you stay 10 more minutes? Avoiding whatever is making them anxious at all costs. The next one is somatic complaints. So it's very important to mention that the mind and the body are very connected. And so especially with anxiety, depression, or other mood disorders, you'll see a lot of things come out physically. And a lot of times you'll see this more often. I mean, it happens in males and females. You might see it more often in males for a bunch of different reasons, but you could see your child or teen like having constant stomach aches, constant headaches. You could see tingling or numbness in the fingers, urgency to use the bathroom a lot, not being able to breathe or having shortness of breath, having like a rapid heartbeat, may have heartburn, chest pain, those types of things. Something very important to mention though with somatic complaints is any good therapist will, if you come to them and say, I think this is just anxiety, they will tell you, make sure you get it ruled out by a doctor first. So make sure you go to the doctor, make sure there's nothing more serious going on. And then after that, they say, it's nothing wrong. It's probably due to anxiety. And we can start working on how to deal with those somatic complaints. But things like chest pain and tingling in the fingers, that could be something very serious. So we just always want to make sure we rule that out first. The next thing is catastrophic reactions. So basically when normal attempts to avoid whatever your child is afraid of don't work, they may escalate in a way that kind of seems like very over the top. So if your child is anxious about going to school, they may have like a full-blown meltdown every morning, a lot of crying, screaming, those types of things. And these reactions can often mimic like bad behavior or disruptive behavior. So if your child gets really anxious about school, you might see them acting out in school because they don't want to be there. And they might think, okay, if I do this, then I get to go home. And then the last thing to mention is seeing like parental accommodations when a child is very worried or anxious. So when children exhibit these types of behaviors, as a parent, if you are a parent to an anxious child, you might naturally respond by shielding the child from whatever they're afraid of to alleviate their bad feelings, which is a very natural response as a parent. You want to protect your child from whatever they're afraid of. However, this can actually be unintentionally harmful, and we'll talk more about that in a couple minutes. But in general, you kind of can see this a lot of the time. If a child is very worried all the time, you'll see the parent kind of accommodating to allow them to avoid whatever they're afraid of. So we're going to do 2 case examples for kind of a typical case that we see at MedPsych, kind of what that anxiety looks like, how it comes out in different ways, and how therapy can be helpful um, in these situations. So, first, we're going to start with we'll just call him Cody. He's the 13-year-old male. He loves being active, playing sports. He's involved in basketball and track at school. And he started to complain of pain and sickness whenever he had a game coming up. And it would kind of get to a point where he was in school and all he was thinking about is, what if I mess up during the game? What if I don't play well? He put a ton of pressure on himself. And it got to a point where he was like, you know what, next year I just don't want to play basketball anymore, even though it's like something, one of his favorite things to do, because he got so um, just upset and anxious whenever he had a game coming up. He would have thoughts like, if I make one mistake, everybody's going to hate me. If I mess up during the game, I'm going to get kicked off the team. Like, his anxiety led to thoughts similar to that. So when Cody came in, he came in because his parents were worried, like, this is something that he loved to do and now he just wants to quit. There's something going on. And so a way that therapy can be helpful in a situation like this is we do cognitive behavioral therapy, which basically connects feelings, thoughts, and behaviors. And it also helps to challenge thoughts and create new, more realistic thoughts. So, for example, if one of his thoughts was, if I mess up, I'm going to get kicked off the team. So we would think, okay, what's the more realistic scenario? If you mess up, maybe the coach will talk to you about it, and then you'll keep going with the game. And maybe you could still have a good game even if you make one or two mistakes. And so through therapy, he received the skills he needed to challenge his anxious thoughts, and then decided he didn't want to quit basketball because he did feel more equipped to handle his anxiety, and his anxiety was definitely contained a little bit better. And it was to a point where it was like lower levels of anxiety. So that's Cody. That's kind of an example that we would see here at MedPsych. Next one is Julie. So she's a 17-year-old female, senior in high school. She describes herself as a perfectionist. She's a straight A student, and she's currently applying to colleges. And from the outside, her parents thought she was doing great. She was involved. She was applying to really good colleges. She was getting straight A's. So someone like this can seem very functional. But she was using self-harm to cope, and they found out about this and were concerned. She also complained about stomach aches, nausea. They went to the doctor to get anything ruled out. They didn't find anything. And so when Julie came to therapy, it allowed her to find healthier coping skills, first of all, to replace the self-harm. Obviously, that's an unhealthy, maladaptive coping skill. And so we were able to work together to think like, okay, if you have that urge or if you need relief from your anxiety, here's more skills that are a lot healthier that can have good outcomes instead of a lot of consequences. And then she also found out how to deal with her perfectionist and anxious tendencies. So as a person, she kind of will probably always be like a type A or a perfectionist, but learning how to kind of balance that and get to a point where she was like, okay, it's okay if I get an A minus or a B. Whereas before, when she came in, if that happened, it was kind of the end of the world. So that's how therapy could help somebody like Julie. So now you might be saying, like, now what? How can I help my child? I've seen some of these things in my child. What do I do about it? The first thing that I always kind of tell parents in therapy is to validate how they're feeling. Very important. Anxiety can be exhausting. It can feel like a huge burden on a child or a teenager who also has a lot of other things going on that are stressful. Middle school, high school is a very tough time in life for a lot of children and teens. There's a lot of changes going on. There's a lot of social stuff that happens in those years. They may be at a point in high school where they want to get into a good college. They're putting a lot of pressure on themselves. So separate from even diagnosed anxiety, middle school, high school can be tough. And so it's important to validate what they're going through, validate how they're feeling, and saying things like, it seems like you are going through a lot right now. How can I help you? Or saying things like, you're putting a lot of pressure on yourself, and I can see that. And I'm really sorry that you're feeling that way. Something as small as that can just make a child feel heard and feel like, okay, I'm not in this alone. So it's important to validate, but at the same time, do not reinforce avoiding behaviors. So I said before, we were going to get back to that and why that is a problem. So anxiety, kind of at the base of it, is having an overactive part of your brain that tells you that you're in danger. So it tells you that you're in danger when you're not. And so if you avoid whatever's making you anxious, so for example, school, if I stay home from school and then I feel better, you're reinforcing the fact that I should just avoid these things and it's going to make everything feel better. So if you are allowing your child to stay home from school day after day, and I know a lot of times it's more complicated than that, or if you're just allowing them to avoid whatever they're afraid of day after day, it's reinforcing that, yes, they should be anxious about this, and avoiding is a good thing because it makes them feel better. So reinforcing the behaviors tells them that. However, the best thing for anxiety, a lot of the time, is to expose yourself to what's making you anxious so that your brain learns, okay, I don't have to feel afraid of this thing. I'm not in danger when I go to school. School is a safe place, and reinforcing those things instead of, yes, this is making me anxious, and when I avoid it, it makes me feel better. So what you can do as a parent is challenge your child to make small steps at facing whatever they're afraid of. So you don't want to just like throw them in all at once. But if I keep using school as an example, so I'll keep going with that. So if they're very afraid of school, maybe saying, okay, try to get to school 4 days this week. Or if they're really only going 1 day a week, okay, let's try to go 2, let's try to go 3, let's try to go 4 days a week, and taking small steps at facing that fear. The next thing, and this can be tough with teenagers especially, but encourage and reinforce open communication. So a way to do that, again, is to validate how they're feeling, to say, to point out when you see that they're not doing so well, to say, like, it seems like there's something going on. Is there any way that I can help, or is there anything that you want to talk about? And just reinforce that open communication with them. Something like mental health and anxiety is especially tough for a teenager, a child, to talk about. First of all, because they might not know what's going on in their brain. They might just know that they feel a certain way and not know how to deal with it. And also just because it's not like a cool thing to talk about mental health a lot of the time. And so they're not talking about it with their friends. They're not talking about it with their parents. So reinforcing that as a parent and allowing for that open communication as a parent is so important. And the next one is to ask for help, because again, a lot of the time teenagers don't want to talk to their parents about these things going on. And so therapy, or just asking maybe a mentor for help. But again, like going to therapy, asking for that type of mental health professional help, that allows them, especially teenagers, to have a space where they feel comfortable talking. They feel like they can share and not have their parent like yelling at them for something that they did, or not having their parents say like, adding to the anxiety. So they feel safe talking, because it's kind of an unbiased opinion. So that's why therapy can be very important for teens, not only that have anxiety, but just maybe need a space to talk about just the normal stressors that come up. So the next thing to talk about is treatment options for anxiety in children and teens. So the first is individual psychotherapy. So that's something that a therapist like me would do, meet with your child, weekly, bi-weekly, or as needed. And it allows for building coping skills. It allows for a safe space to process and talk about what's on their mind. And it just allows for kind of changing their mindset about anxiety, um, learning that facing their anxiety is going to be more helpful than avoiding, things like that. Within individual psychotherapy, we also offer family sessions. So what that would look like would be either meeting with the parents separately and then coming together as a child and a parent, just to say, these are the things we're working on. This is how you can reinforce this coping skill that we're learning this week at home. And if a lot of the stress or the anxiety is coming from communication at home, we can work on that kind of family communication. And then another thing that we offer, like in individual psychotherapy, is also coordination with schools. And so, what that would look like is kind of getting consent from you to talk with the school. And if you feel like they need certain accommodations because their anxiety is really affecting them academically, we can provide support for that. Another treatment option is group therapy. So, group therapy is such a great resource to use. We actually have an anxiety group running right now. So, if you're interested in that, you can go on our website and learn a little bit more about that. That's run by my coworkers, Elisa and Steve. They are so awesome. And it actually sounds like a pretty fun group to be a part of. So, the reason that group therapy can be really great is just because it provides a kind of support system for your child. It allows them to see that they're not the only one that's dealing with some of these things, um, and just allows them to process in a space where there's other people that are going through the same types of things. So group therapy can be either a great supplement to individual therapy, or it can be good on its own too. Lastly, we have medication and psychiatry. So, our psychiatrists are really great here. Even if you feel like you're very, very unsure about medication for your child, I know it's a big decision, especially for younger children and teens, to put them on medication. So our psychiatrists aren't going to push you to put them on a certain medication. If you just want to talk to a psychiatrist and see what your options are, our psychiatrists do a great job of just being kind of a sounding board, allowing to give you some more information. A lot of our psychiatrists will also recommend like different supplements that might be helpful if you don't want a prescription medication. There's some great over-the-counter stuff that they can recommend. And so it's always great to talk to a psychiatrist if you feel like you're at a point where your child might need a little bit of extra help or a little bit of extra support with treatment and with dealing with anxiety. So those are the kind of different treatment options that we have. And so now we're going to open it up to question and answer. So I'm going to stop sharing my screen. And so if you have any questions, you can put it in the chat box and I'll see it kind of come up. So I'll give it a minute or two to do that. Nothing comes up, I have some questions that I get a lot of the time from parents that I can kind of answer, but you can go ahead and shoot some questions and answers in there. The one question I get a lot as you're thinking of questions, thinking of things to write in. One question I get a lot is, can I send my child to therapy even if I feel like they don't have, like a diagnosable anxiety? And my answer is yes, absolutely yes. I feel like I'm biased because I'm a therapist. I feel like everybody at some point in their life can benefit from therapy, especially children who just go through just the everyday things of a middle schooler or a high schooler. There's so much that goes on during those years. They have physical changes in their body that sometimes they feel uncomfortable with. They have, there's a lot of social stuff that goes on during that time where um, it's just difficult to deal with. There's a lot of like friendships that end and begin, and finding their place in high school, finding where they fit in. Like that's a lot of things to deal with all at once, along with the hormonal physical changes that they go through. And so even if you feel like my child isn't overly anxious, my child isn't overly depressed or whatever it is, but you feel like they could benefit from someone to talk to, absolutely talk to a therapist. Even if you just want to have like a couple of sessions or just see kind of how you like it, you're always welcome to do that. And so, yeah, therapy can just be helpful for so many, so many people. I feel like for every high schooler, they could honestly benefit from therapy. Again, I'm biased, but yeah. Um, some questions coming in, some self-regulation strategies that you would suggest for parents. That's a great one. So I don't know if you're talking about self-regulation for your child that you can reinforce as a parent or your own self-regulation strategies, but I'll kind of answer both sides. So for a child, okay, thank you for the clarification. So self-regulation strategies for a child, there's so many different ones that you could do. Something I always kind of start out with that seems very simple, but can be very effective is just deep breaths, deep breathing. So breathing in for 4 seconds, holding for 4 seconds, breathing out for 4 seconds. This breathing is great because it's accessible anywhere you go. So you don't need something specific to use it at school. You don't need something specific to use it at home. You can do it wherever you are. So deep breaths can be a great one. Having a list of things that they enjoy doing is another good one, like having that list accessible to them. So getting together with your child and saying, let's write down 10 things that are enjoyable, that are calming, and kind of creating a toolbox of different strategies to use. So maybe something super calming for them is just listening to music. Maybe something calming for them is taking a hot shower or drinking tea. So just having those simple things written down and saying, okay, I'm having a very anxious moment. I'm having an anxious day. Let me try some of these things that are going on. So we kind of call that like their toolbox of things. And maybe breathing is one of those things on there. So a lot of the time it's just things that are naturally calming to them that are great to self-regulate. Trying to think of other things. You know, these are what we call like distress tolerance things that you can do, but imagining a safe space in their mind if they go to two different places that are triggering for them. So maybe at school they feel like home is their safe place, and if they leave home they don't feel good. So imagery is a great one that they can use. So taking a minute, taking deep breaths, picturing their safe space is something that can be helpful for them as well. um, Taking short breaks are a great thing if your child gets anxious around doing homework or gets very anxious in class. Taking a short break, getting a drink, coming back, getting a snack, coming back. So taking those short breaks can be really self-regulating. A lot of these things are very simple things, but can be very effective. The last one that I want to mention, as far as self-regulation goes, and then I'll move on to another question, is using cold water or ice. So there's a skill called TIP skill. So it is using temperature, intense exercise, or paced breathing. So these are three that are great. So temperature is using like cold water, or so putting your hands under cold water, taking a cold shower, or using like a cold pack or ice and putting it on like a sensitive area like the back of your neck, and like holding your breath and then releasing. So this gives a very similar reaction to like jumping in a cold pool, if you've ever done that, where you're like kind of gives that feeling and allows you to reset. So it's actually a very great evidence-based practice that can be super helpful, and that is really effective for kids who are really anxious or having a moment of like crisis, to kind of help them reset and be present. And then the other skills in tip are intense exercise. So really getting that heart rate up, going for a run, doing like a little, I don't know, YouTube workout or something, just something to get that heart rate up is really, really helpful. And then the pace breathing, something that I talked about before. So that's kind of the tip skill that comes from DBT, dialectical behavior therapy. So those are just a couple self-regulation strategies that come up. Um, Someone talking about how it's really hard because their child might refuse to speak to anyone about how they're feeling. Um, so bringing them to therapy can be, from a child's perspective, it can be really intimidating and very scary. But if you just say, hey, we're just going to go talk to somebody, the therapists here are really great. They're not intimidating people. A lot of times, after a child goes to one therapy session or two therapy sessions, they start to feel a little more comfortable, like, okay, it's not this big scary thing. Um, Therapy oftentimes gets like, kind of like, there's like weird feelings around it. And so just allowing if your child, if you bring them to one or two sessions, they might start to feel more comfortable as just we build rapport. And as therapists, we can see if like there is a, like I ask every first session, like the child individually, like, how do you feel about being here? And sometimes they just say, I don't want to be here. My parents forcing me to be here. And then we kind of meet the child where they're at and just say, okay, like that's totally fine. Um, Kind of meet them where they're at, say a lot of people don't like coming to therapy. It's okay. Like, is there anything you feel like you want to get out of being here? And if not, we kind of just start by very basic, like rapport building that therapeutic relationship. So then they feel more comfortable in future sessions. So sometimes that's just the only thing that we work on for a few weeks, is just building that therapeutic relationship, and then kind of going from there. So that is tough when your child is refusing to speak to anyone, especially if they're older and you can't just like put them in the car or bring them over. And we also offer virtual sessions, which can also be a little less intimidating sometimes, for people. So if you're like, okay, can you just do like a 30 minutes with this person on virtual, and just see how it goes? If that's the only way you can kind of get them in the door, that's fine too. So as therapists at MedPsych, we just meet your child where they're at and allow them to have just a safe space um, to open up in a process and to talk about things that are going on. But that can be a really tough thing, having, like, if your child is refusing. But we try our best to, again, find a good fit for them, because that can be really important too. So sometimes a child likes somebody who's younger, sometimes they like someone who's a little bit older, sometimes they male or female. So we also, our intake team does a really good job of trying to find the right fit for your child. If they've had a bad experience in therapy before, it could be that it was just not the right fit for them. So again, our intake team does a great job of finding a good fit, which can be really helpful when your child is a little bit nervous about coming to therapy as well. Any other questions that are coming up? It could be about really anything. If it's more about general like mood disorders, how to deal with, you know, any anxiety that your child is facing. You might have a question about the more specific diagnosis that are coming that I had on that one page, anything like that. I'm going to talk about panic attacks for a second, because that could be something that's really scary as a parent to witness. So panic attacks they are like a diagnosable thing that often go along with another anxiety diagnosis. So panic attacks can look different depending on how your child experiences anxiety. Oftentimes, when you hear panic attack, you'll think like unable to breathe, feeling like crying, a lot of times shaking. And yes, that can be what you see um, as a panic attack, but sometimes it's just feeling super nauseous, feeling like they're going to throw up, and like just feeling frozen because of that. You can see like a lot of heartburn, chest pain, and feeling like they don't know what to do with that. So sometimes panic attacks can look different than what we kind of think of in our head when we hear panic attack. The best thing that you can do for a panic attack is kind of let it come and go. Deep breathing is a great regulation technique for when there's a panic attack, especially if it involves um, having a hard time breathing. Um, yeah, so panic attacks can be scary, but just sitting with your child, allowing them to just feel safe and letting it ride out is kind of the one of the best things that you can do. Um, if you come to therapy and your child is presenting with panic attacks, a lot of the time we'll provide good regulation techniques for them in the moment, and maybe talk about planning around that, and also work with you as a parent of how to deal with that as well. So that's something that can be helpful, um, especially with a child or teen. But I know panic attacks can be a very scary thing to witness, um, and a very scary thing for your child to go through. Any other questions that are coming up? Do maybe one or two more. I can kind of talk about the different anxiety diagnosis since we have some time. Um, Let me go back up to that slide. So just something that we can talk about is just the different diagnoses, what they kind of look like. So generalized anxiety disorder kind of just looks like what it sounds like, general anxiety. So fear about a lot of different things. A lot of times you'll see it um, not as like being afraid of one thing, but just again, like just seeing your child is very high strung, worrying a lot, um, having difficulty with plans and things like that, maybe being tired all the time, being restless. Um, so yeah, it's a more just like general worry about a lot of different things. Next, we have panic disorder, which I just talked about. So it can be on its own, but then there's also what's called a panic attack specifier. So that goes along with different diagnoses. So it might be generalized anxiety with panic attacks. Next, we have agoraphobia or other specific phobia. So agoraphobia is being afraid of like being in an enclosed area or a very open area, being in line somewhere and feeling stuck. And then there's other phobias like maybe fear of spiders, fear of school, fear of leaving the house, different things like that. There's social anxiety disorder. This is a more common one that I see as well. So if your child just has really difficulty, like doesn't like hanging out with friends, doesn't like leaving home, feels embarrassed a lot, they may come off as just like a very shy child that doesn't talk a lot. And oftentimes that can just come from fear of like embarrassing themselves if they say something wrong. We have separation anxiety disorder. That can look like difficulty just separating from mom and dad when they're being dropped off at school, just difficulty separating from anywhere that they wouldn't be with their parent or caregiver. Selective mutism, this one's a little bit different than the others. The anxiety comes out in just a way of not speaking. And so we'll see the most common is a child speaking at home and being totally what you would think is normal at home, and then at school refusing to speak to a teacher or just refusing to speak at all in school or in a classroom setting. So the anxiety is kind of coming out in a little bit of a different way. And then obsessive compulsive disorder, again, it's not a type of anxiety, but it can come out like that. So you see a lot of children with like very intrusive thoughts. So your child might describe like seeing something in their head over and over again, like something could be a violent thing, like, or um, sometimes like depending on the OCD, it could be just being afraid of like the car because they're seeing a car crash over and over again. You might see it come out in just like checking, so checking that the car doors are locked, checking that they unplug their straightener or their hair dryer before they go to school, different things like that. So it comes out in different compulsions. So they have obsession, so they have a thought of like, for example, the house burning down a lot. So they act on that anxiety by checking again and again that things are unplugged, the oven is off, things like that. So that can sometimes come out like anxiety just because you see them worried about certain things, but it's a little bit more than that. And there is specific treatment for OCD. Yeah. Any other questions? So the last thing I'll kind of just talk about is as a parent, again, not trying to allow your child to avoid different things and allowing them to have small steps um, in getting closer to being okay with whatever they're afraid of. So a lot of the times it is just that exposure work. So if you have maybe a younger or an older child that's afraid of mom leaving home, start with, okay, I'm going to leave and I'm going to go get the mail and I'm going to come back. And it's going to be like 4 or 5 minutes. So start with that. Get them used to that. Then they feel okay with that. Then say, okay, I'm going to go out and run errands for an hour. I'll be back. Okay. And so we give them the tools that they need to deal with the anxiety during their whatever they're being exposed to as a fear. So we teach them how to regulate themselves, how to stay calm. And then eventually they learn, okay, I don't need to be afraid of this. I was okay when mom left for 5 minutes. I was okay when mom left for an hour, whatever it is. And kind of going from there. I did get a question about treatment for OCD. It's similar to what I was just talking about, like exposure work. So the most, I would say most frequently used practice for OCD is exposure and response prevention. So it's called ERP. So basically teaching the child to or the teenager to be exposed to whatever they are fearing. To learn how to deal with those intrusive thoughts and little by little exposing them to whatever they're afraid of and then allowing them to see, okay, it's okay. The worst, even if the worst happens, I'll be okay. I don't need to do like even if I don't check this thing 5 times, my house isn't going to burn down, that type of thing. So it's a lot of like similar to anxiety, but more like exposure work to decrease the obsessive thoughts, decrease the compulsions that they're seeing. So that's just a little snippet on OCD. Maybe that's another webinar we can do is about OCD. But yeah, any last questions before we end here? Just another thought, just living with a child who has anxiety can be really tough as a parent, just seeing your child struggle with any mental health disorder. And so another just reason for therapy and for psychiatry is just to get another support, another person in your corner that can help you, that can walk you through. Because as a parent, that's really hard to deal with all the time. And so I often recommend like therapy for parents as well that are going through that because it's really hard to do. Yeah, if there's no more questions, we can end here. I want to thank you all for coming to our webinar. So we have kind of like a bunch of webinars that are going on. I think the next one is with Dr. Hannah. I think it's about ADHD. So that is something that's coming up. You can see them on the different webinars on our website. And if you watch today's webinar, if you feel like you want to learn more about what we offer at MedPsych, maybe come in for therapy, or if you're interested in psychiatry, anything like that, you can reach out via the email or the phone number on our website, which I believe is medpsychnj.com. And we can get you connected. Our intake team can get you connected with somebody here. And even if you just want to kind of dip your toe in, see how it goes. Oh, it's medpsychealth.com. I apologize, not medpsychnj, medpsychealth.com. So you can go on there. You can get connected with our intake team and kind of figure out what you're looking for. So if you have any more questions about therapy, about psychiatry, you can always ask our intake team here. So yeah, thank you so much for coming, for just learning more about anxiety in children and teens. I hope it was helpful. And if you have any more questions, you can always reach out to us at the number on our website. All right.